One of the most important things you can do when you're looking for grant funding is to find a match. The way I do it is I subscribe to a bunch of different newsletters with funding opportunities. One of them is with the HRSA and specifically a newsletter on rural health. Their newsletters come out, I believe it's once or twice a week, and it's got notices on trends, research, as well as funding. One of the most interesting things I think to grasp when you're looking for grant funding is that the reason the healthcare funding comes about is because researchers found some data that looks promising to them. It looks promising, and they say, okay, let's put that out for essentially a clinical trial and pay these programs to see if it'll work and collect the data. One of the ones I did, which was very illustrative of this, is a colon cancer screening. That we all know that colon cancer is really prevalent right now. It's a big deal. It's becoming worse, and the actual exam for it is really hard to sell to patients. People don't want to do it. They'll try every way out of doing that. So the thought was, if we can make the screening easier, the data should support it. I can't remember the actual percentages, but if you do it at-home guaiac test, I can't remember the data, but it's fairly decent screening. There's that, and there's also the stools sample sent off, which is even better because it does micro. But given your choice, let's say it's 70% accurate reading on the home guaiac, or 0% of compliance and getting the colonoscopy, I mean, obviously your number is going to have to be improved. So they wanted to see, and they were willing to fund to see if rural practitioners can get better compliance with colon cancer screening, and what was the data for that. And so they can go back and present that and maybe create some funding around that, to make sure that is availability for other people, for other patients. So what we did, I found something that spoke to, I want to do rural health. I'm very invested in that. That's something I care about deeply. And my coworker that I'm working with is interested in working with adolescents that are at risk for opioid substance use, which meshes quite nicely with this grant that I found. So what we did, and I'm in the process of doing, and we're going to work on this over the next couple weeks, is working on the grant itself. So once you find that in that application I showed you, or the notice, you click on that, and there's a ton of information there. So one of the things here I looked at the applications due May 6th. This is April 14th. So I've got 3 weeks to get that turned in. So the next thing I looked at, I've reviewed this with my partner, and we agree that our business structure is such that this is something that we're interested in, and we believe we can make a difference with this. So next step, we find out if we can do it. Like are we eligible? Are we okay with that? One of the things is very important to note is I'm a for-profit agency, and as a for-profit, obviously I can't get those nonprofit grants. So first thing you want to do, eligibility, go to that. Institution, higher education, nonprofits, private, for-profit, that would be me right there. So we're good to go. So given that, then the eligibility I'm not worried about. But I did double check the rural health grants eligibility. It basically said that 98% of the state of Idaho qualifies, and especially because this is just an aside, but if you look at demographics, it rates differently for different things. Mental health usually is a lot lower coverage in any area, so that's why Idaho had such a poor score for mental health resources. So then the purpose here is there's 4 goals. When I look at crafting this is going to be very important. My target population, does this address the people that I want to address? So at risk for substance use disorder, already have symptoms of in treatment for or in recovery, their families and caregivers, impacted members of the community. So yes, we're targeting adolescents with substance use disorder. So yes. Program highlights, I don't care about that right at the moment. My first in the review is, am I going to do this? Are we going to invest time to get this started? So background and their goals. So they've already done some work with this initiative. Like I said, this is we're not coming in as starting anything. We're coming in to see how we can get this initiative delivered on a local level in our area. And if you look here, it already says, they've seen already, they've got the data to support why we need it. Strong evidence. Again, back to what I was saying, this is evidence-based medicine that we're doing and seeing if we can't take these theories and putting them into practice locally. So program guidance, general project guidelines. When they say here, these are words that I highlight. We strongly encourage you to establish services in a one-stop shop model. That means you need to do it, honestly. And so when I'm going through this, I'm looking for red flags or things that might be a little problematic for us to get done or just needs a little more thought behind it. The other thing I want you to consider too when you're looking at these grants, this one's a big one because we're looking at a large rural area. We're going to be employing some people. If you go back up to the top, this is also a 4-year commitment, not counting the pre and post things that we, meetings and research or just the writing the grant, basically. But yeah, it's at least a 4-year project. So you also got to say, this really something I want to get involved in because this is a big commitment in time. So for us, in our situation, we decided, yes, that would be absolutely wonderful because part of the 4-year commitment is getting these programs set up and building them out. So it's always, in my mind, it's always great to not just start something, but see where you can go with it. And this is a great opportunity for that. So we're very interested in this. Again, it's very clear, there's the 4 goals, examples. They give you examples, appendix, networking, support and guidance. And so they pretty much lay out exactly. So look at that. See, we strongly encourage in bold. What do you think we're going to do there? That's going to be highlighted and it's going to be done. Performance reporting, all these justice involved. I mean, they're laying out exactly what I need to do. So this is it's intimidating when you glance at it, but when you get down to the nitty-gritty, they're helping you. They want you to do this. So saying that, the one way to screw this up, the easiest way, I guess, to screw up a grant is to not follow directions. If you look through this package, basically, there is multiple instructions on how to do this. There are, let's get to the application part, the actual application. Contents and format. Here we go. Here's the project abstract. They'll show you exactly what they expect you to put in there. Required format. You must format your narratives and attachment using our required formats for font, size, margins, etc. Any deviation, and they'll toss it. If everything's not addressed in this, look at this background. State, describe, summarize, state. So what I do when I'm looking at this, I've already decided now that we're going to do this. So the way I break this down next is I actually have already done this. I turn this into a Word document for myself. And then I create an outline. And I just start filling it in. Obviously, I'm going to use their headlines right there. And then I'll just cut and paste underneath all this to make sure I've got it. And what I do, and this is just the way I do things, especially because this one's a very large project, is I'll get it down here and get this as clean and beautiful as I want this to be. And then I'll have the other people involved in the project look at it, make sure I'm on track. Then I'll go to the narratives, the actual formatting, the attachments that they want, and plug it in from there. So I'd never work from the actual attachments that they want us to put things in. So here's that. And so, yeah, I'm not going to put that in until I'm ready. Then that will be looked at again and gone over. So that's it for today. I wanted to show you an overview of how you go about this. And this is a real life example. We're going to do this, and we're going to go over all of the components here, because honestly, if you can do all of these things on a big project like this, you could do a simple one with your hands tied behind your back. But also want to, again, just look at this. I mean, these people are not trying to be jerks. They want to give this money out. Okay, that's number one. That's what I want you to keep in mind. They want to give you the money. So don't mess it up. Basically, if you got questions, they got answers. I've already contacted Sarah O'Donnell. She got back to me on a question I had same day, actually. Grants.gov and SAM.gov, if you go for these big ones, you do have to be registered with both of those with your actual business. But look at this. I mean, here's how to prepare your application page. They will walk you through it step by step. You got a question, they got an answer. I'm super impressed with how helpful HRSA's sites are. So if the main thing is your concept of what you want to do with this, they've got the parameters, but within those parameters, they want to see some creativity. They want to see you addressing all their touch points. But you could literally, I think, in fact, I know there's a checklist in here somewhere too. And I'm not sure where but they even created a checklist as well before you submit. Theirs is not as detailed as I want to do, but it's there. The application checklist, yeah. But that's just making sure you've got all of your documents turned in. But, I mean, there you go. Excuse me. Yeah, this is, as long as you've got a great idea and you can follow directions, you can get this grant. The other thing they did have when they put the first notice out is a webinar, question and answer webinar. And so, like, anytime they have one of those and they advertise it, you go to those because they do help, because they kind of explain a lot of what was going on here. And sometimes you hear it, you get a little better sense of it than by reading. So if you have any questions, please contact me. Go to Nursing Professionals at School and tell us what you think. Thanks.